So, welcome to the free webinar, the first in the series of Releasing Eczema. I am excited to be here with you today and to share just some information and some tips and tools that I've learned over the years in my experience with eczema. So, I am Dr. Valerie A. Mills. I am a non-medical doctor and I am passionate about educating and empowering individuals of faith to tap into their body's healing mechanisms and heal well from the inside out. So, this is the Releasing Eczema series. So as a disclaimer, I want to remind you that the information that I'm sharing with you is not intended to replace a one-on-one relationship with your qualified healthcare practitioner, and it is not intended as medical advice. It is intended to educate and empower you to make informed decisions regarding your health and your well-being. And I encourage you to do your own research and share your experiences with others. So continue to just take charge of your health. So let's go over here. So I want to share a little with you about my story for those of you who may not know. As an infant, I had a very serious expression of eczema. From what I was told at that time, it was one of the worst cases that they had ever seen. And it was not even given a name until I was 8 months of age. I remember going back and forth to the dermatologist as I aged. I remember my parents being told that I would grow out of it, but instead I grew into it. It grew with me and it followed me even through my college years and even as I started working as a nurse after graduating from nursing school. So when I was able to have the opportunity to do my own research and to really get some answers as to why this was following me and not leaving me, then I began my journey to heal. So as we go through this, you're going to learn some of the things that I did. So this is one picture, only one that I could find. Most of the pictures when I had the really terrible expressions of eczema have been lost. But this was my right hand. And at the time, this particular picture is better than what it was. It used to be way behind my wrist and it used to be on both hands, but it was always worse on the right hand. So I can remember the itching. I can remember scratching and scarring and rashing because anytime with eczema, anytime you itch and anytime you scratch, you're going to rash. And then you put yourself at the opportunity of having some scarring. So that was my right hand. So you're going to learn what eczema is. You're going to learn some traditional treatments for eczema, and then you're going to learn 5 tips for getting past skin distress. You're actually going to learn more than that, but that's where we're going to start. So eczema dermatitis is a group of conditions that cause the skin to become red, itchy, and inflamed. And it is an itch that cannot be described. I can remember as a young girl when I was itchy that the only way that I can get some moments of relief was to turn on the eye stove and to just put my hand over it or my arm or whatever was itching at the time. And then also the other thing that I used to do is to used to take extremely hot baths in water that should have scalded me. But those were 2 of the things that I did to in hopes of relieving that itch, that unrelentless itch that would not go away. And so I also remember as a young girl having to wrap my hands so that I wouldn't scratch to bleeding while I was asleep. And I even had to wrap my hands when I started working as a nurse because the itching and the rashing was getting worse until I learned a few things. So there are 30 million people in the United States that have a diagnosis of eczema. And that's a huge amount of people. And it is various ages. One of the things that is so distressing to me is to see young children with this expression of eczema because I know full well what they may be experiencing when it comes to itching and not getting any relief. So when it comes to the cause of eczema, the exact cause is not known as of yet. So what happens when you're developing eczema? It may be something that is attributed to a combination of genes and environmental triggers. So there's no one cause for eczema. When an irritant or an allergen switches on the immune system, skin cells don't behave as they should, and they cause these eczema flare-ups. And again, as I said, one of the things that I can really relate to is seeing a child who is itchy, who has had these redness and these raised skin areas, and they're just messing with their face or their arms or their legs or behind their knees or in the bend of their arms, because the rash is there, the itch is there, and there is just, they can't express what is going on with them, but they're just kind of fidgety because there's something triggering their immune system to attack itself. And so eczema is really an autoimmune issue. So the body is attacking itself and it's attacking the skin. So I wanted to share with you some basic things that are traditionally done when it comes to caring for eczema. And so one of the biggest things that I remember being told was to keep the symptoms under control. And to keep the symptoms under control, you have to have a basic understanding of why you are having the issue. But some of the things to do is to know the triggers, and we'll go over this a little bit more, is to know your triggers. That's one of the basic things. Know your triggers so that whenever symptoms arise, you'll be able to control them. And you can control the symptoms by knowing your triggers so that you won't have these expressions. The other thing to do is to establish a regular bathing routine or moisturizing routine, so that your skin won't have those opportunities to experience that excessive dryness, that excessive itchiness. So being able to keep it moist and to keep it clean. And also using traditional means, or using traditional over-the-counter medications or prescriptions. Things were consistently prescribed to me when I was younger. I remember the topical steroids. I remember the ointments. I remember the creams. I even remember being prescribed tetracycline to help. None of those things helped me. I could not take the tetracycline. Even Benadryl was prescribed for me. I could not even take the Benadryl. The Benadryl, even just a small amount, would allow me to, the Benadryl would allow me to sleep too much. And I understand that my connection is not so good. So I'm not sure what's going on with that, but hold on one moment. Let me check something. And if it doesn't get better, connected. So hopefully it will be in the chat to let me know if the sound is better or not. Yes or no? Can anyone tell me if the sound is better or not? Let me see over here. Bear with me for a moment. Let me see what is going on. I think I lost my screen share. Okay, just glibly at times. Good for you. All right, so let me get my screen back up. I lost my screen share when we were doing that. So, screen share. Resume screen share. So, please let me know in the chat if you can see my screen. Okay, still sharing. Thank you. All right, so I want to go back to the basic eczema skincare. So I was talking about using some prescription medications and having the topical steroids and even some of the antibiotics or the antihistamine type things to help, which they didn't help. The Benadryl made me sleep too long. I couldn't stay awake in class. The tetracycline, my body just did not like, so I could not take it at all. So basically, the other thing to do when it comes to basic eczema care is to watch for signs of infection on the skin, such as pus-filled bumps, pain, redness, or even heat. And that was one of the reasons that I was prescribed the tetracycline, is because I would have these pus-filled bumps and the redness. So that heat was there. So those are some basic eczema care measures that is promoted by the National Eczema Association, as well as the Tartary Allergy and Eczema Associates. So some other options for eczema, I've already said, to establish a daily skincare routine. Like I said, I used to do very hot, scalding baths. But actually, you should use lukewarm water for bathing. You should not do that scalding hot water, but use lukewarm water for bathing. And then really recognize stressful situations and events, because stress can trigger an outbreak. The stress can be anything from being in a stressful situation, being having something inside your body that is stressful. That can be a food, an allergen. It can be something in the environment. Something as simple as a smell can be a stressful, significant situation and promote your body to have an expression of an outbreak of eczema. Another option is to be mindful of the scratching and the rubbing. I can just remember scratching and rubbing and not even realizing that I was doing it. And at the same time, that was actually amplifying the issue, because like I stated, with eczema, when you scratch, you rash. It is deemed to be the itch that rashes, because as you scratch, you rash. Another option for eczema was phototherapy. I also remember as a young girl going to the dermatologist, being put under the ultraviolet light to get some rays. I was never really told to go out in the sun. I always remember being put under that light. So not sure how much it helped, but that's what happened. Prescription medications for whatever, and it's usually symptomatic treatment when it comes to the prescriptions for eczema. And then other options are alternative therapies and then supplementation. So those are some of the more common things that are recommended for caring for eczema. So basically for me, when I was able to take things into my own hands and start to do my own research, then I had to learn that there was symptoms being expressed, but it had to be a deeper issue. There had to be a cause for this problem that my body was expressing. So as I did my research and started to go beyond the symptoms and get to the problem and what was causing the problem, then I was able to start to have a better understanding and to allow my body to have the opportunity to heal. And in my journey, I learned 3 I's, and I like to say the I's have it. I learned that I was ignorant to a lot of things when it comes to health. Even though I went to nursing school, there was a lot of things that I didn't learn. We didn't have a real formal nutrition course. So based on what I have learned now in my nutritional studies and based on nursing school, I didn't learn anything about nutrition. So I was very ignorant. And there is a saying that ignorance is bliss. Well, ignorance may be bliss for some, but it is very expensive when you don't know. And then the other eye that I like to talk about is inflammation, because there was some underlying inflammation going on within my body. It's like a fire was taking place, and that fire was fueling my skin to express this. And in my learning and in my research, I learned that eczema is actually connected to endocrine disorders, which in my family on the paternal side and the maternal side, there is the expression of diabetes and blood sugar dysregulation. And I learned a long time ago that eczema is related to that. So that inflammation going on there can pose problems in any area of your body. Mine just happened to be my integumentary skin. And then infection. So you can have these 3 things going on in your life and it not be beneficial for you: ignorance, inflammation, and infection. Usually when there's some inflammation, there's probably some hidden infection. And even as of late, I have learned that my body has been expressing some chronic infections that I have now been dealing with and are actually resolving. So all of these things, the things that I've learned over the time has given me a deeper insight into why my body was expressing the eczema, the dermatitis. So the question I always ask is why? And if my mother were here, she will tell you I have many questions. I'm asking why this and why that, because I want to have an understanding. One of my favorite passages of scripture is, with all thy get an understanding. It says wisdom is the principal thing, but with all thy get and understand. I believe when we have an understanding, then we are better able to function. So why is a huge question that I ask even when I'm working with clients. Why? So the 5 tips that I mentioned, releasing eczema, 5 tips to getting over or getting past skin distress. So we're going to start talking about the past. And so when I did work in the hospital, I used to be a CPR instructor. I currently still have my certification to teach. However, I haven't been teaching it. But I can always remember when we were teaching about CPR, we would do some first aid type things. And so one of the first things to do in first aid, remembering to evaluate the danger. And if there was a fire going on, we always had to remember the acronym PASS. Pull the trigger or pull the pin, aim the hose at the base of the fire, squeeze the handle and sweep it back and forth. That's the pass to put out a fire. And as I stated, in eczema, there is some inflammation going on. There is some autoimmunity being expressed. And so we need to get to the source of the fire and pass it. We need to put it out. So I'm going to share my pass, these 5 tips of what I've learned to get past skin distress. So I want to just say this right now. I have a gift for you, but make sure that you've submitted your email address and I will forward this to you. This will be 10 tips to enhance your glow for healthy hair, skin, and nails. So I mentioned this fire that I learned was going on inside of my body. And just because I had taught CPR and first aid so much, the only thing I could attribute to was a fire extinguisher. You use a fire extinguisher to put out a fire. So let's put out this fire. So the P, when it comes to eczema or really any skin issue, is to pull the triggers out. Find out what your triggers are. I learned I had some food triggers. I had some smell triggers. I had some clothes triggers, and I had some allergen triggers. So some of the food triggers that I learned about was gluten and dairy and wheat and soy and peanuts and pecans, other nuts, because all nuts are not equal. Just because they're a nut doesn't mean you may have a response to them. But those were triggers for me. Smells, even the smell of peanuts would make me break out. The smell of perfumes would make me break out. There used to be a perfume, I think it was called Red. Anytime I smell that perfume, I started to itch and break out. So to this day, I don't like perfume. I will create something with some essential oils, but I don't mess with perfumes. Even the fumes of gasoline can be triggers for some. I learned that as well. And also my dad, who passed away at age 56, he was diabetic. He actually, before he was about to retire from his job, and he got exposed to some fuel fumes. He was a truck driver and he got exposed to fumes, and it threw his body out of balance, and he never got to go back to work. So I had apparently had that trait of smells bothering me. And then clothes. I have always been conscientious about the material of clothing that I wear. I used to not wear jeans, and then to this, because they used to make me itch. To this day, I don't like to wear jeans. Wool, could not wear wool, acrylic. So those particular fabrics bothered my skin. They would itch, they would make me scratch, I would rash, and we would go in that cycle again. And then allergens, anything that you know you're allergic to. Like I said, I learned when I was 2 years old. I didn't learn it at 2 years old, I learned it later. But at 2 years old, I was in my grandfather's kitchen. Don't know why I was in the kitchen by myself. It's sitting up under the cabinet, and I was eating pecans. At the time, I thought I got choked. But as I learned and did my own research, I was actually having a full-blown allergic reaction to pecans. And even since then, back to the peanuts, I have had things that have peanuts in them. Immediately, my lips started to swell, my throat started to close. And then one time, another thing I learned that I had an allergy to was lemonade. It was a lemonade in a carton. I don't remember what the brand was, but I remember having drank lemonade because I used to drink lemonade all the time. But I drank lemonade one night and woke up because I couldn't breathe. And I got up and looked in the mirror. My face was huge. It looked like I had been beat in the face. I was so swollen in the face. My throat was swollen and my lips were swollen. And we tracked it back to having that lemonade. So I'm very cautious when I drink lemonade. If I'm doing lemon, even now, I only do a little bit because citrus tends to not be something my body likes. I am confident it is better now, but I don't even want to try it. Even down to oranges. They would make my stomach cramp. I would break out. I would itch. So bottom line is the P in the past to getting past skin distress is to find your triggers and pull them out. Pull them out. One of the other things that I learned, I've talked a little bit more about food, is how food affects your skin. And I like to call it forkitude. And forkitude is what is at the end of your fork or your spoon or whatever you cut with your knife, because it matters. What you eat matters. Diets high in sugar and refined carbohydrates cause insulin levels to spike, which can contribute to inflammation. So be conscientious about the sugars that you consume. Deficiencies in certain nutrients, including vitamins and minerals, are known to influence the severity of disease. So let's just talk a little bit about some of these vitamins and minerals. I've picked out 4. Vitamin D3, or vitamin D, the sunshine vitamin. It has been shown that individuals with autoimmune disorders or cancer or diabetes or eczema tend to be deficient in vitamin D. And if you may be out in the sun a lot, but you may not actually be absorbing it, or if you are absorbing it, your body may not be processing it. And people of color tend to not absorb the rate or process the vitamin D from the sun well because of the darker pigment. And then also you might have an expression of a genetic SNP, a tendency not to process it because of a genetic SNP. Now, I have had the opportunity to have a genetic testing done, and I actually have the genetic SNP that lets my body know, that lets me know that my body does not process vitamin D well. So it is necessary for me to supplement with vitamin D. Both of my parents, I got it from both of my parents, and my mother has been tested. She has both SNPs from her parents. So I can probably safely say that the majority of people with darker pigment skin have a SNP for vitamin D. In the wintertime, it is necessary to usually amp up your vitamin D. But when you are deficient in vitamin D, it can impact the expression of eczema or other autoimmune disorders. And then vitamin A is another vitamin. Vitamin A is stored in fat cells, and it helps to promote sebum. And sebum is the natural oil produced by your body that helps to keep the skin hydrated. And we need to stay hydrated. And then, so also, if you're deficient in vitamin A, it could lead to dry and itchy skin. And it also may increase the risk of developing acne. Now, I know I'm talking about releasing eczema, but this can also impact the expression of acne if you're deficient in vitamin A. Zinc is another one. So zinc supports hair follicles and tissue growth, and a deficiency can lead to difficulty digesting and absorbing food, which will lead to a common word that we've heard, leaky gut. So if you have a leaky gut, you're not absorbing, processing these vitamins and minerals, you may have expressions of skin issues or other health issues. The zinc helps to have reduce the inflammation and heal the delaying of skin. Okay. Yes, 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 yes. So that's zinc. And let's see what else I have on here. So food matters, matters. Consuming whole food, fresh fruits and vegetables, healthy fats, and optimal hydration is foundational for your journey to experience total healing and total relief from skin distress. So hydrate, hydrate, hydrate. So the P is pull that trigger. So let's talk about the A. When it comes to the A impasse, you want to make sure that you're asking the right questions. Now, like I said, I ask a lot of questions. Some of the questions when I'm working with people is, when did the outbreak begin? How often do they flare up? Or how often do you have these flare-ups? Does anyone in your family have a history of skin issues? Does anyone in your family have a history of blood sugar dysregulation? Is there acne or psoriasis or rosacea or eczema or hives or itchy skin? These are just some of the questions. Is your skin, does it tend to have thickened patches on your palms or the soles of your feet? Are you expressing skin nodules, having redness or purplish colors? Were you breastfed? Were you cesarean or vaginal birth? Usually children who are of a vaginal birth tend to have a lesser degree of eczema, if any, because they get the natural immunity from their mother. However, cesarean, they don't get that because they're not coming through the birth canal. And that breastfed, you're also getting the nutrients from the mom. You're getting, I think it's the meconium you call it. You get that, you're getting that natural colostrum from the mom. Are there any other allergies that your body expresses? Have you ever used antibiotics? Because that damages your gut lining. And even steroids. Remember I said I used to be prescribed topical steroids? Well, that was ruining my gut. That was totally ruining my gut. So questions are very helpful. So you want to make sure that you pull the triggers. You want to make sure that you ask the right questions. And then the first S is to seed the terrain. You want to make sure that you are aware that 70 to 80% of your immune system is in your gastrointestinal tract, the gut. So nourishing and feeding the terrain of your gut, your gastrointestinal tract, with probiotics, fermented foods, so that that bacteria can be there in the correct balance, so that it will afford your body the opportunity to process the vitamins and the minerals that you consume. There are probiotics that are necessary for you to even simply process the B vitamins optimally. So making sure that you are seeding the terrain. And then the other S is to reset from stress. Now, stress can be anything. It can be anything, but one of the stressors that I want to pull out is sleep. You want to make sure that you get optimal sleep. Optimal sleep allows you to boost your immune system. It helps you to prevent weight gain, and it actually helps you to have a better mood. Now, when it comes to sleep, one of the things that I like to share is the organ clock. Because if you're not able to sleep well, then your body's not able to detoxify well. And if you're not able to detoxify well, then you are putting yourself at the risk of not eliminating or evacuating toxins very well. And if your skin is the weaker system, then that's where it's going to be expressed. So usually the liver and the gallbladder do their best work at night. Usually 11 a.m. to 11 p.m. to 3 a.m. is the best time for the gallbladder and the liver to do its work, to detoxify the system. And so when you're getting up in the morning, you're able to eliminate through your bowels. And then you're setting your body at the stage to whenever you do put nourishment in there, it is optimally going to have the opportunity to receive that nourishment so that it can be processed as usable fuel for your body and your energy for the day. So this organ clock is one thing that I like to talk to people about. So if you maybe tend to wake up at a certain hour of the night, usually consistently, then that's something to ask a question about. What is my body trying to tell me? Why am I waking up at the same time and can't go back to sleep? Why am I waking up? Am I needing to use the bathroom? Is my blood sugar dropping? Is my thyroid not functioning properly? Whatever it is, what is the expression that your body is telling you if you're waking up at certain times of the night? So the organ clock. Another S that I want to talk about is skin care products. These are monumental in your expression of eczema and getting rid of skin distress. So there are things that are in body care products that are toxic. They can be carcinogenic. They are like xenoestrogens, things that mimic estrogen, phytoestrogens, even though plants are supported to or let me see, we talk about plants helping us with our bodies and being healthy, but sometimes, particularly if you are a person who may be demonstrating estrogen dominance, say you may have an expression of fibrocystic tissue in your breast, or even fibrocystic breast, or uterine fibroids, or some other buildup of tissue, then you may be estrogen dominant. And it is wise to give attention to things that mimic how estrogen act, as well as phytoestrogen, how they, even though they're helpful, because phytoestrogens can look like the estrogens and your body can receive them as estrogens, and they can house themselves in the place of the estrogens and promote your body to be more estrogen dominant. So we have to be mindful of toxic body care. I have been doing other research for some other clients that I'm working with, particularly because I've had a lot of people ask me about uterine fibroids. But I'm learning that even lavender, because it is a phytoestrogen, it is a wonderful plant. But there are some situations you may not need to use it. And when you're expressing uterine fibroids, that is one of the situations. Lavender and rosemary. And I love rosemary. I love to put rosemary in the air. I love to put rosemary in my skin products. But that may not be the thing to do if someone is estrogen dominant, because your body's going to think it is that estrogen and then not be able to get rid of it if you have something going on with your detoxification pathways. Some other toxins to think about. Now, these are things that are in body care products. Formaldehyde, it is used for an embalming fluid, and it's an antifreeze. And then you have the phthalates that are in feminine products, and parabens that are in shampoos and other products that we put on our body, and they tend to promote breast cancer. And you think about this, even the synthetic colors, you think about this now, these are toxins. And if you have a body system, your liver or your kidneys, your liver not able to detoxify properly, your kidneys not able to filter properly, you have these toxins circulating in your blood, housing in fat cells. These fat cells are actually stagnant, and now you have these toxic things circulating in your bloodstream, and you have these expressions of whatever the disease process is. And since we're talking about skin, it can express itself in your skin because these toxic things are being compounded on there, even down to using your clothes detergent. It is very good to look at the products in your skin clothes detergents, because they get in your clothes, and so it can take time to get that out of your clothes, and you're wearing the clothes, so what the clothes are washed in is getting in your skin. You see this toxic effect? So releasing eczema is about being educated, is about learning what may be a trigger if you don't already know that it's a trigger, and the triggers that you know of, get rid of them, pull them out, ask questions, see the terrain, get some sleep, reset stress, and just make sure that we are monitoring our skincare products. So the path is this: pull the triggers, ask the right questions, see the terrain, and get some sleep. So the past, the fullness of my story. So this, I don't remember what year this was taken, but this was when the eczema had cleared up on my right hand. And even though my right hand is a little darker than my left hand, it's clear. And since I learned to go through some investigation, then I really haven't had any expressions of eczema. So I wanted to share that. So Are you ready to experience getting past skin distress? You can do this. I am hopeful that you have learned some things that allow you to start today to decrease your opportunity to have itchy, dry skin, to have eczema outbreaks, to have acne outbreaks, to have rosacea outbreaks, and to improve your skin's glow and to improve your sleep. So, whatever your health journey is, include something that's going to support your body so that it can do its business of being well from the inside out. Take your path. The sleep, the stress, the exercise, the diet, choose what is necessary for you right now. So you can begin right now. So that is the end of my presentation, but I want you to make sure that you have an opportunity to get this gift. So make sure you have submitted your email address. And if you want to find me, you can find me on Instagram at Valerie A. Mills, and you can find me on Facebook at Dr. Valerie A. Mills. And you can catch one of my Facebook Lives that I do on Thursdays currently at 10:30. I am branching out to do other social media platforms, but you can find me there. So I hope this webinar has gotten you some information to help you not only release eczema if that is an issue for you, but to begin your journey in releasing health in whatever your health issue is. So thank you for your time. Let me stop the recording and the share, and we will answer some questions.